In the previous classes, we already discussed about the physical, mental, and socially challenged children and their causes and prevention and management measures. Okay, so in today's class, we will be discussing in detail about what are the welfare services are provided to these kind of challenged children in India by the government. Okay, so let's see in detail. So first one, educational facilities. So any kind of children, whether it is a normal child or a challenge child, all children they have the right to receive appropriate and adequate education. So for providing these educational facilities, the government of India has started a program that is Sarva Shiksha Abhiyan, that is SSA. So Sarva Shiksha Abhiyan is the government of India's flagship program for the achievement of universal elementary education for all the children. Okay, so this program mainly aims to give free and compulsory education to all the children between the age group of 6 to 14 years of age. So here we are not considering whether they are challenged or whether they are normal or whether they are the male or female. There is no discrimination. The all children between the age group of 6 to 14 is provided with a free and compulsory education. So the free inclusive education is the integral part of the Sarva Shiksha Abhiyan, and their major goal is to provide education for all as a reality dream by the year 2010. So already the dream has been achieved. Now every child in the Indian country that is 6 to 4 between 6 to 14 years of age group is receiving free and compulsory education. So that is one. Next is regarding special schools. So for children with the disabilities, the government has started special schools which are located in the urban areas run by the voluntary organization. So at present, there are 3,000 special schools for the differently able children are working across the country. So out of these 3,000 special schools, 900 are marked for the hearing impaired child, then 400 for the visually impaired children, then 1000 for mentally retarded children, and the remaining 700 for the children with any other kind of physical disabilities. Then regarding the identification and admission of these children to these special schools is mainly depend upon any kind of disability that should be a 40 percentage or more. So children with 40 percentage or more disability will be identified early and they will be given admission to these schools, that is the special schools. Okay, next one is regarding self-employment measures. So here most of the children with these kind of disabilities, which include physical, mental and social disabilities, they require a long-term treatment as well as the medication in order to bring back them to their normal life. So it usually takes so many years. So during these years, along with their treatment, during their way to recovery, they will be provided with vocational training and rehabilitation services. So during these vocational training and rehabilitation services, these children are constantly assessed for their skills for any kind of employment. And based upon the assessment findings and based upon the skills they are having and based upon the interest of the children, certain job skills are taught to these children by the trainers at the self-employment centers working across the country. Hence, once they are recovered from their disease condition or their disability, they can learn, they can do the particular employment what they have learned during the recovery period. Okay. And next one, free distribution of aids and appliances. So here, quality aids and appliances are provided to differently abled persons in Kerala whose annual income is less than 60,000 per year. Okay, so here the aids and appliances are like artificial limb, then tricycles, then wheelchairs, then calipers, crutches, then hearing aids, then colostomy bag, etc., and which is supplied to these people once in every 3 years. Okay, and these people are selected or the beneficiaries are selected on the basis of the medical camps which is conducted at the district or the block level or in the panchayat level with the help of health department. So every 3 years they will conduct the annual checkup for the disability, and from that the selected persons or the children will be provided with these aids as well as the appliances. Next is regarding the proficiency award to the differentially abled children. So here, in order to motivate and enhance the morale of these disabled children, the corporation is distributing a cash award of 2,500, like orthopedically disabled children and the children those who are having speech and hearing impairment, visual impairment, mentally retarded children, etc. And those who are securing highest mark in the SSLC as well as the higher secondary examination. So this will help them to boost their morale as well as them. We are trying to motivate them. Okay. Next is regarding the fixed deposit scheme for the severely disabled children. So there are so many disabled children are born for the poor parents. So here this program which is mainly focusing upon to provide the financial security to the children, disabled children, those who are below the age of 8 years. So under this scheme, the children those who are below the age of 8 years, those who are having 60% or more disability and whose annual income is less than, whose parents' annual income is less than 60,000, the corporation will be depositing an amount of 50,000 for the boys and 20,000 for the girls. And regarding the release of this fund, this fund they can release only after the age of 18 years for any kind of self-employment for the male baby or for the purpose of marriage. So here they have to send all the certificates, documents, everything to the government, and after assessing the genuinity of everything, the government will issue the order for releasing the money. So here the parents, those annual income is less than 60,000 and the child is having more than 60% of disability, 15,000 amount for boys and 20,000 for the female children is deposited. Okay. Next is regarding district disability rehabilitation centers, that is known as DDRC. So this is an initiative which is mainly given by the Ministry of Social Justice and Empowerment, Government of India, to facilitate comprehensive services to the persons with the disabilities in the rural area. So here these units, they will provide mainly the rehabilitation services to the disability children as well as the adult people, like identification, early identification of the disability, awareness generation, then early detection and appropriate treatment, then provision of fitment services, then repairing of their assistive devices, then therapeutic services like physiotherapy, speech therapy, everything is provided to them at free of cost. That is the functions of district disability rehabilitation centers. Next is regarding the occasional rehabilitation centers. So where vocational rehabilitation of the handicapped person is a process which is mainly focusing up to provide a suitable employment to these children. So the main purpose is to assess the occasional psychological needs of the handicapped person and to render rehabilitation services. So at present, across India, 21 vocational rehabilitation centers are working and they are providing these rehabilitation services to the children as well as the adults based upon their needs. Okay. Next is regarding child guidance clinic. So they are the specialized clinics that usually deals with the children of normal and abnormal intelligence, which are those who are exhibiting a range of behavioral as well as the psychological problem. So the first child guidance clinic was started in Chicago in 1990, and later the child guidance clinics were started in India also in 1939 by the Tata Institute of Mumbai. So in child guidance clinic, the children with a wide variety of abnormal intelligence and a very wide range of behavioral problems are assessed. So here so many members are included in the child guidance clinic team, which include a psychiatrist, a public health nurse, then pediatrician will be there, psychologist, teachers will be available, then nurses will be available, a neurologist will be there, then social worker, speech therapist, occupational therapist, all will be available here. And the major services provided in the child guidance clinic include they helps in managing the behavioral problems, the learning difficulties, then emotional problems, adjustment problem, learning problems, etc. At the same time, they also address the intellectual deficiencies and the social legal issues faced by the children. And the pediatrician will be available. They will be taking care of the physical health of the child. And there will be a psychiatrist and he will be helped by others in providing a appropriate psychiatric care based upon the proper diagnosis and the treatment option. And the major core of the child guidance clinic therapy is to provide proper psychotherapy in order to restore the positive feelings and security in the child. So these all are the some of the common services which is available for the disabled children in India. So thank you.